So next, so this is an important diagram showing the female reproductive system. So coming to the basic first year anatomy, this is the ovary, fallopian tube, uterus, endometrium, cervix, and the vagina. So there are two ovaries, two fallopian tubes communicating with the uterine cavity, and the cervix and the vagina. Next slide, please. This is slide from the physiology of the ovulation. Very important slide, as you might be coming across patients who will tell you that doctor माझे असे डे 3 चे एम्ब्रियो ट्रान्सफर केले, डे 4 चे केले, मग मी YouTube वर वाचलं की डे 5 चे केल्यानंतर जास्त सक्सेस रेट असतो वगैरे वगैरे. Every patient will ask you a lot of questions where because of the YouTube and Google, so they have a half of the knowledge which we have. So then again coming to the physiology. So ovary, the ovulation will release the egg. Then egg is fertilized. Then this is the 2pn stage. Zygote is formed in the 2-cell stage, 4-cell stage, 8-cell, morula, blastocyst, and finally the blastocyst is getting implanted inside the uterus. So see, whatever the procedure we are doing in the IVF, so you are well aware that the IVF is in vitro fertilization. So it is the fertilization outside the body, and the fertilization which occurs inside the body is in vivo fertilization. So we do IVF in the lab. So whatever the stages which happen in the body, all the stages are again replicated inside the lab, and we grow the embryo from the fertilization stage to the blastocyst stage. So this is very important diagram to understand the further slides. Next. So these are the causes of infertility. Next. As the rate of infertility is increasing in the modern society, it is the need of the hour to help the patients finding difficulty in conception with ART treatment program. You might have heard news in the different newspapers that the problem of infertility is increasing. The problem of infertility is increasing due to our modern lifestyle, increased female education, late marriages, and all the other factors which the modern lifestyle has, we will come to know later on. So these are causing the more infertility problems. So some of the older gynecologists or the gynecologists which have passed before 1980 or 1990, they usually say that IVF centers are mushrooming or the infertility centers are mushrooming. Why the centers will mushroom? If there is a need, then only the things will start opening, and that's why the number of IVF cycle has gone in lakhs now. So it is unimaginable. So whenever a patient or your relative or some of your close one will go to IVF, then only you will realize what is the real problem. Next slide, please. So when male and female gametes are manipulated outside the body, we call it as assisted reproduction. The goal of the ARP is to put adequate number of selected spermatozoa as close as possible to the oocyte, which may help in the process of fertilization. So what are the treatments available at a typical fertility center? So these are the hysteroscopy, laparoscopy, IUI, IVF, ICSI, laser, blastocyst culture, gamete freezing, oocyte, sperm or eggs, and then the gamete donation programs. So we'll go one by one. So hysteroscopy is a minimally invasive surgery. The surgeon inserts a tiny telescope that is called a hysteroscope to cervix in the uterus. It is generally used to examine the shape of the uterus, lining of the uterus, evidence of intrauterine pathology like fibroids or polyps, and to visualize the openings of the fallopian tubes. So this is a diagram which shows how the hysteroscopy is done. So this is the uterus and this is the uterine cavity. So with the help of this cuspoid speculum, we are inserting this telescope inside the uterine cavity. Usually a distending medium like normal saline is used, and then we can see the inside of the uterine cavity in a medical grade monitor. Next slide, please. So again, laparoscopy is a surgery that uses a thin lighted tube put through a cut incision in the belly to look at the pelvic organs. As we know that laparoscopy is done to check or remove any abnormal growths. The tissue samples can be taken for biopsy or to check and treat conditions like endometriosis, ectopic pregnancy, or PID. So this is how the laparoscopy is done. As we all know that the telescope is put inside the abdomen, and then we put another instrument and we can manipulate and treat the conditions inside the abdominal cavity. So this is an ovarian drilling picture. So I have put this slide very purposefully because almost 5% of the girls are having PCOS, and this is a very common problem. And the obesity is increasing in the teenage groups, and the prevalence of PCOS is increasing. So how to treat this PCOS? So in the teenage group, if the girl is not menstruating in 3 months, then we have to give some progesterone tablet for her menstruation or some OCPs. If she is menstruating for example 2 months or 2.5 months, don't give any medications and counsel the mother that it is okay if she menstruates for after 2 months or 2.5 months. Otherwise, usually these PCOS teenage girls are taking the OCPs and medication continuously. The main treatment for the PCOS is to control the weight and maintain the healthy PMS. So, for example, a PCOS patient has come after the marriage and she doesn't want to conceive, then it is advisable for her to reduce the weight and to take the OCPs to regularize her hormones. Usually in the PCOS, the problem is with the androgens. The androgen excess is the problem. If we start with some anti-androgen drugs like cyproterm acetate containing OCPs like Pimson 35, you might be knowing. If you give a 3 months course of Pimson 35 to the patient, then usually their hormonal value is normalized, and then these patients usually ovulate spontaneously later. Another important test I will suggest you, do a day 2 LH. If the day 2 LH is more than 10, then it's a very simple test and very affordable for the patient. If the patient is not ovulating, do a day 2 LH. If the day 2 LH is more than 10, then she is not going to ovulate anyway. So you have crimson for 3 months, and again you can do ovulation study and you can induce the patient. So this procedure is reserved for the patients in whom the drugs are failed and you have no other remedy. Then we can use a laparoscopic ovarian drilling. And laparoscopic ovarian drilling should be reserved for the patients which are resistant to the medications. Sometimes it happens that the patient undergoes a laparoscopic drilling and she is taking treatment for 4, 5, 6, 7, 8 years. And later on, her AMH decreases, and finally, this is an iatrogenic damage. We cannot say iatrogenic damage, but due to the patient's lengthy attitude of postponing the treatments, usually this may happen. Next slide, please. So this is a video showing IUI processing. Active sperms are separated. Next slide. So this is the IUI procedure. So again, I'm very much interested in the history. So I'll tell you the history of the IUIs, huh? And how the IUI is not so much useful for the patients. I'll tell you. So whatever the sperms we have washed and active sperms we have taken, so these sperms are collected, and then we put these sperms to a plastic cannula inside the uterine cavity. So like this, the sperms are put, and the main aim of this IUI is to put the sperms very near to the oocyte. So again, the older gynecologist before 1990, before 2000, before the ICSI was invented, the success rate was of the IVF was only 30%. So I think 3 years back, I went to MGM to meet the HOD sir. He is from army. Then he told me that they used to do the IVF in Ashwini hospital, and the success rate was around 5 to 10%. They used to prepare the media themselves. Now we are getting the media from the Spain and Germany, which are very refined and commercially prepared media. At that time, they used to prepare the media in the lab, and at that time, success rate was only 10%. So it was a government hospital, and it was okay to have such success rate. But in private setup, again the success rate was only 20 to 25% before the advent of the ICSI. And where my training institute where I learned my IVF in Bihar, Patna, with Dr. Himanshu Roy. So I was there in 2006, 2006-7. So there, Dr. Himanshu Roy used to do daily 30, 40 IUIs. And then now their IUI number has decreased because IUI success rate per cycle is only around 12 to 15%, maximum success. And usually, whatever the patients we are getting, they have some another problem. Some patients have decreased ovarian reserve. Some patients have male fat. So again, the actual success rate of the IUI is only 10%. And in IUI also, there is a different school of thought for the IUIs. You might be seeing some patients which are coming to you for injections and IUIs. So they will say that no, these injections and advise that please give me these injections. So you will ask what procedure you are doing. They will say that we are undergoing IUI. So the patient's expectations are very high, but the patient doesn't know that the success is only 10%. And when you are giving HMGs to the IUI patient, then usually the cost of the HMG and the IUI cycle goes to 25 to 30,000. So then, if compared to the cost of the IVF and IUI, there is success rate. So IUIs can be done for the patients with unexplained infertility and young patients. If the patients are older, then it is better to go for the IVF cycles. So this is very important information I want to share with you because many a times the patient doesn't know the success rate. For example, I'll tell you, if the success rate of having a pregnancy in a single cycle with an ovulatory woman and all there is no male factor or everything is normal is around 8%. This is the ASRM data. So, years of age, then we should not waste patients' time, and we should tell them to go to a gynecologist or fertility specialist to have early pregnancy. Next slide. So, coming to the IVF. So, in IVF, what we do? So, IVF looks very simple. Uh, Giving the injections, retrieving the eggs, making embryos, and transferring them. So injections, then getting the eggs and transferring the embryos. Next slide. So this is a video, very beautiful video, so that we can understand the procedure well.
In vitro fertilization. IVF is the process of removing eggs from ovaries, fertilizing them with sperms in the laboratory, and then replacing the embryo egg back into the uterus. First, doctors would insert an ultrasound probe into the vagina to observe the follicles. When they are mature enough, eggs will be removed with a special egg retrieval needle. The retrieved oocytes are identified under the microscope. The eggs will be placed in a suitable culture medium immediately. After the egg retrieval, eggs will be individually placed in small drops of fresh culture medium in a new culture dish. The eggs are placed for a few hours. Then, sperms will be injected into drops of culture medium containing eggs. Under the microscope, the eggs are surrounded by a bunch of actively swimming sperms. The sperms will swim towards the eggs, but only one of them will eventually be able to get inside the egg. About 17 hours later, the pronuclei of the sperm and egg will appear and later fuse together to form a zygote. After another 24 hours, the zygote will divide into a full cell. The doctor will use ultrasound guidance to insert the ET catheter containing the embryo into the uterus. The embryo will be carefully deposited onto the appropriate side of the uterus under the ultrasound guidance. Patients will have their pregnancy test about 2 weeks later to confirm whether successful implantation of the embryo has taken place.
So this is the procedure. Sometimes we are fascinated by the procedures and we want to see the procedure in actual. So anybody from your society wants to see the procedure live are welcome to our center. Because my one of friend is a cardiac surgeon, so I told him कि वो beating heart पे तुम सर्जरी करता है तो I want to see. So I once went to see the cardiac surgeon. So if anyone is interested, welcome. So coming to the ICSI, so in ICSI, as we discuss, uh, nowadays nobody is doing IVF. All the centers are doing ICSI procedure because nobody is going to take risks if the fertilization doesn't occur with the IVF. So everybody does ICSI. So in ICSI, we use this holding tool, and this is an injecting needle, and the egg is holded by this holding tool, and then we inject the sperm with this needle inside the egg. So we'll see again a video about this. So this is a needle, and with suction mechanism they are taking the sperm inside the injecting needle. So now this is the egg, and then they will inject the sperm inside the egg cell. So now egg, this sperm has been injected inside. So
This video shows
usually the ICSI is done by a trained embryologist, and usually IVF specialist doesn't have any role to do the ICSI. Previously, all the work was done by only the IVF people, but now with the ease and to have more expertise, ICSI is done by senior embryologist. So again coming
this
to
video shows laser.
so laser is a procedure where we are creating a gap in the shell of the embryo so that the success rate means the attachment of the embryo to the uterine lining is more if you do a laser.
There's assisted hatching being done on a day 3 8-cell embryo. The laser fires in the area of the red circle. We pulse the laser once, twice, and a third time. Now the hatching is completed, and there is a gap in the shell at the red arrow. Assisted hatching is believed to make it easier for the embryo to hatch out of its shell, thereby increasing the probability of implantation and pregnancy.
When there is a
This
zona is thick, then usually we do the laser, or sometimes if the patient is getting recurrent failures, then we recommend to go for laser procedure. So this is about the non-invasive PGT. We will not go in details. Next slide. So about the PGT, the PGT facility is available at our center, and also the genetic counseling facility is also available free of cost. The patients, uh, some patients have some genetically abnormal babies, so we can screen the parents, and there are few conditions, not all, that can be identified on the PGT, and then the healthy embryos can be transferred. Next slide. So this is the tri-gas incubator we have, in which we do a blastocyst culture, and that is the gold standard for the culture of the embryos. Next slide. So this is the ICSI machine in which we do this ICSI procedure. Next slide. Again, ICSI machine. This is the incubator. So in the incubator, there is 37 degree Celsius temperature, and this is a CO2 incubator where we can keep the eggs and embryo for first 2 days, and later on for the culture we use a tri-gas incubator. So in the incubator, the environment is like our body, so that the embryos can have a good environment for the growth. Next slide. So these are the cryocans in which we can store our embryos, eggs, then sperms, and usually these cryocans have a temperature of minus 194 degrees Celsius. So we have a quality check system. Daily we check whether the liquid nitrogen feed inside the can is at the optimum level or not. In the our Konkan region, usually in the interior, some of patients' husbands are in Gulf countries, or they are working outside for 6 months, 1 year. Or some are in ship, some are in fishing. So we have facility to have semen freezing, and husband is doing their work, and we are doing IUS for them here. So that can also be done for some of your patients are interested like that. Next slide. So this is an air purifier. We have also installed an AHU in the lab, so that uh, the air quality, if the air quality is optimum, then usually the embryo quality and the fragmentation rate is less, and we have a at least 5% increased success rate in the overall pregnancy. So again, this is the centrifuge we use to spin the semen sample for the IUS and semen sample for the IVF. This thing. So this is our facility video.